Step 1. Check lesion suitability and position of the treatment area. Using the alignment template provided, check the lesion is no greater than 24 mm in diameter and fits completely within the circle of the template. The treatment head is hinged for maximum flexibility. The template should be rotated around the lesion such that the hinge of the device allows it to bend around the body curve. Step 2. Mark the positioning. Dots or lines should be made on the skin using a skin marker to use as a guideline for the treatment head. Step 3. Debride the lesion. Before applying the photosensitizing agent, the lesion surface should be prepared to remove scales and crusts and roughen the surface of the lesion. Step 4. Apply the photosensitizing agent. The photosensitizing agent should be applied in an even 1 mm thick layer across the lesion. Step 5. Cover with transparent dressing. The entire area should be covered with a transparent occlusive dressing such as Tegaderm. This should be at least 3 cm by 3 cm in diameter and let at least 95% of light through. Slight pressure should be applied to ensure the pharmaceutical covers the whole lesion and extends beyond the lesion margin to a distance of 5 mm. Step 6. Apply treatment head directly over the lesion. Peel back the adhesive liner on the light-emitting treatment head and align over the markings. Once secure, peel back the remainder of the lining and complete the process. Step 7. Secure cord and attach head to control unit. Secure the cord at 25 cm intervals to ensure patient's normal movement is not impeded and that the path of the cord to the battery pack lies under the clothes of the patient. A maximum of 3 treatment heads can be attached at any one time. Step 8. Set the device by following on-screen instructions. Press and hold the select key for 3 to 5 seconds to turn on the device. The device has 2 settings. To toggle between manual and auto, press the up key. To deliver treatment, ensure auto mode is showing. Press select key to confirm. Attach all treatment heads and press select when completed. Press the select key again to start the countdown process. The device will count down for 3 hours and the light will then automatically come on for 3 hours. Step 9. Explain what happens next. The patient does not have to stay in the clinic for the duration of the treatment and will be able to leave the clinic. The light will remain inactive for 3 hours to allow for drug absorption, and after 3 hours will eliminate for a total of 3 hours at a low irradiance level. Once the treatment has been completed, the device will say end. If during treatment the head becomes detached from the control device, a loud bleep will sound to alert the patient. An error message will also appear on the screen. Once reattached, the countdown will continue from where it left off. The clinician should retain the charger at all times. We recommend that the device case and some dressing is provided to the patient and given instructions on how to remove the device and return it. Dress the area and confirm next appointment. Step 10. Consider patient suitability. It should be noted that although the device is entirely ambulatory and allows the patient to leave the clinic, the clinician performing the treatment must make a clinical judgment as to the competency of the patient to comply with the treatment. This should include an analysis of whether the patient will understand the treatment and whether they will also understand the need to remove the device only after the treatment has completed. The analysis should also look at the physical ability of the patient so that they can read the screen on the controller, that they can reach the plaster, and that they have the strength to remove the plaster.